Okay, good night, everybody. Can you hear me clearly? Hello?
Yes, teacher.
Okay, thank you.
Yes, we can hear you.
Thank you. I'm sorry for the delay. I'm trying to connect the Zoom session with the laptop, but it's not possible. As you know, I have problems with my internet connection in my laptop, but from the cell phone it's working. Well, it looks like if it's working. So let's try to work from this device. As you know, I'm gonna send the slides following the attendance, so don't worry about it. I'm gonna send it the same as the previous class with the by WhatsApp, by your personal WhatsApp. So let's start this. Okay. Okay, let's try to go ahead. Today we have these contents: invasive and non-invasive procedures, of course, checking the difference of them, the laboratory tests, a general view about endoscopy, X-rays, computed tomography, the CT scan, the MRI, magnetic resonance imaging, the ultrasound, and electrocardiogram. It looks too much contents, but it's not. You're going to realize that it's easy to make. Talking about invasive and non-invasive procedures, we must consider this definition for understanding the basis of the medical research. In the previous class, we were talking about the vital signs, the medical evaluation, well, a general view of them, considering that all of them are non-invasive procedures. I mean, procedures that doesn't require inserting an instrument through the skin or into a body opening. In easy words, they don't hurt. But of course, we have more procedures to develop, maybe with a specialist, a technician, who knows, that are non-invasive too. And we also have invasive procedures, that is the opposite situation. That one when the body is invaded or entered by a needle, tube, device, or scope. According to this, we have the chance to check into the body or to check some fluids or some tissues according to the situation. And then we can make a better medical research supporting our diagnosis, right? So an invasive procedure is one where purposeful or deliberate access to the body is gained via an incision, percutaneous puncture, where instrumentation is used in addition to the puncture needle, or instrumentation via natural orifice. I mean mouth, the anus, or well, you know about it, or nose. We have this chance, right? So invasive, of course, are not comfortable. Patients usually feel upset about it. Don't like this, but there's no way to do it. But actually, it's not. It's just a needle. We can say just a needle because we have the practice. We have the, well, we have all the training for taking this option, right? So Whereas non-invasive tests do not require breaking the skin or entering the body, well, mouth, nose, the anus, or something like that, or maybe a puncture in the abdomen, and when we use that orifice, there are options. The non-invasive tests include the deep palpation, of course, X-rays, and checking the blood pressure. And this idea that we were talking from yesterday, from Monday, I mean. Laboratory tests. According to the test you ask for, they could be invasive or non-invasive. Biological, logical function, biological view, we can recognize an invasive and non-invasive. As a general view, a laboratory test is a medical procedure that involves testing a sample of blood, urine, or other substance or fluid from the body. They can help to determine a diagnosis, plan treatment, check to see if treatment is working, or monitor the disease over time. So let's consider this as a general definition. While taking blood, we all know how to make it. We all have the chance to consider this. And, well, the most common procedure is the venipuncture. When the phlebotomist, a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube, which is sent to the hematology laboratory for analysis. So usually the phlebotomist can find a vein in the inner part of the elbow, the antecubital fossa, that is easy accessible. He or she may apply a tourniquet, a tight band above the site, and the patient may be asked to clench their hands to make a fist, to push, to make a pressure, right? In order to make the vein more prominent. Afterwards, the patient may be asked to press lightly on a dressing, usually a piece of gauze, to help to take blood to clot and to prevent swelling and hematoma, as a black and blue mark or a bruise. Bruise is the most name of this, where the bone was punctured. Okay, a bruise is a specific mark. Bruising can be used to describe number of bruises on a larger area. The patient exhibited bruising on the right forearm, for example. We all have the chance to send or to see a request, a lab request. This is a microbiology request, just as an example. But you can see here we have lots of abbreviations just for checking in order to choose which one we really need. These abbreviations are universal, of course, and going into translation to Spanish, of course, they might change a little bit. But as a general word in English, you can find it everybody all around the world, everywhere all around the world. More examples how a lab request is prepared. Some of them have the full term with abbreviations in parentheses, just for ensuring that you know what we are talking about. Some of them are talking about specific microorganisms. So let's consider this. We all know, we have the chance, we have an idea how it works, because we all have the opportunity to send a lab request. I mean, some important meanings that are into this presentation are in this chart. That's why our blue guy is helping us to recognize this important slide. You have the MSU, CSU, NP secretions, and according to this, you can realize the meaning, and it's easy to work on this just with practice. Easy to make it, easy to catch the meaning. MSU, midstream urine. We all know that this is the best part of urine to analyze and, well, to catch the bacteria that is causing the urinary tract infection. For example, the CSF, cerebrospinal fluid. So the CSF is is there is properly working in order to catch the meaning. It's easy to make. Then we have, for example, the PCR, polymerase chain reaction, considering that this test is very commonly useful by infectious diseases, right? I'm sorry. About biochemistry and hematology lab report. As a general view, you got the name. You can see in the chart on the right side. You got the full name and the abbreviation. Of course, we got the value, the range according to the lab that is sending this report, and the unit they are using from. So keep on practicing on memorizing the abbreviations about lab tests, because these abbreviations are very, very important in order to work properly. I mean, during homework, during our common job, we're going to find lots of this. The same with electrolytes, with lots of these details. And the units, of course, are different from one country to another. In USA, these units for talking about values are the ones. In Latin America, we use different values, well, different units, but when we make the mathematical conversion, they are the same. You can memorize, you can convert them, it's a personal choice. In the Caribbean, for example, we use the same as American units. So when I came back here to Bolivia, it was so hard to realize the difference, and was a little confusing to check or to memorize again all of this, but it's possible to make it, you know. Just as a general information, I'm sending the normal values for USA. So check them, check the units they use, the values they use, the abbreviations they have. And if there's any question about it, we can solve it tomorrow about the meanings, okay? But check all of this. Check the, as you can see, all of them are with abbreviations. For example, in the chart about the hemogram, the red blood count, hematocrit, hemoglobin, white blood count, ESR, also check all of them and keep on practicing. And for catching the meaning, I'm sending you a chart for not being in trouble about the meaning, how it means G/L, of course, grams per liter. But consider this for reading properly. And well, according to this, in homework, we have exercises with this full readings. Some expressions to understand this, why they are so important, are these terms. When we have the chance to check values that are elevated, that are up, we have these four options in the first box, in the first circle with the plus. We can say up, elevated, high, or raised. 4 ways to give an answer about a value. When the results are within the normal range, we can say, let's go to the bubble. For example, potassium is within normal limits, potassium is normal, or potassium is unremarkable. The most common expression by experience is unremarkable. When values are low, you have 3 ways to give me this answer. You can say down, low, or reduced. For example, potassium is reduced, or sodium is, I don't know, is down or is low. According to the context, you can choose one of these expressions and make it fit in order to talk properly. Check this slide. Of course, it's important because we have the chance to talk properly, right? Then we have the endoscopy. And well, we know this is a procedure that uses an endoscope to examine the inside of the body. We all know an endoscope is a thin tube-like instrument with a light and lens for viewing. It may also have a tool to remove tissue to be checked under a microscope for signs of disease. We all know this. We all have the chance to maybe check by during the med school or check by the internet how endoscopy is developed, how this procedure is going on, and how the images look like. So considering this, we have to take about its characteristics. So let me see. Misael, can you hear me? Misael. Okay,
yes, I can hear.
Okay, perfect. Can you read this slide, please?
Yeah. A typical endoscope is a flexible tube which insert through one of the natural orifice openings such as the anus or mouth. Right endoscope, which cannot bend, are also used but are inserted through small incision, surgical cuts. The shells contain several channels to transmit light from the outside and imaging from the inside and allow different instruments to be used.
Okay, thank you. As you can see, well, everything is clear with this situation, and we have in this picture how it works. We have the eyepiece, we have the tube for putting the instruments, and we have the flexible light tube with glass fiber in order to check to realize the light. Now we have the flexible shaft for light and water, of course, two different channels, different chambers for working properly with this device. In this slide, we can check how it works, how it gets into the stomach, and how we realize the picture, how it's being taken. All the process, all the procedure, how it is going on, we can check how the esophagus is, what it's looking like, how the stomach, and according to the experience of the doctor who's developing this, the gastroenterologist usually, you can check all the stomach structures inside. You get the duodenum, and going to an esophageal gastroduodenendoscopy, you have the chance to go ahead to and check more sequences. And of course, taking in account you are into the body, you have the chance to take biopsy, okay? And according to the biopsy, to define the diagnosis. That's the purpose. We have some functions of endoscopy that of course are to provide diagnostic information, to excise, cut out diseased tissue or growths such as polyps, to clear obstructions, as I was telling you, to take biopsy, to cauterize a site of bleeding by applying heat. And about endoscopy, it's usually a safe procedure, a common one. And we can say it's a safe procedure. It takes very little time, making the comparison with other invasive procedures. You will walk back home in most cases, of course, because it's scheduled. You don't have to stay at the hospital. At least you have a pathological situation. It's aseptic, of course. It doesn't interfere with the breathing. It helps in your diagnosis, of course. We all know about it, just making a review. Well, this is an enteroscopy, just some pictures showing how it works. You have the chance to pass away from the duodenum and go into the small intestine, the small bowel. And using the balloon, you can fixate the tube and then go ahead with the light. Of course, it's not for all the bowel, but it could work. Okay. Again, we are showing how we started the enteroscopy, just as an extra slide for catching vocabulary tips. And then the enteroscope is inserted. According to that, it could last 1 or 2 hours because it's a longer structure that we are checking. And according to your recovery, well, doctor is going to talk to you, right? He's going to show you what it means. Some instructions that are focused on enteroscopy are the ones that we, as the doctors, use while developing this procedure. But of course, we can make it fit to describe other kind of procedures for another situations. So let's read. Juliana, can you hear me? Juliana.
Yes, Miss.
Okay, thank you.
Okay, thank you. Can you?
Yes.
Yes.
Read this slide, please.
Please.
Okay. Now I'm just lubricating the tube with a jelly which contains a local anesthetic. It will help to ensure a smooth passage as it passes down, and you shouldn't feel too much. I'm going to feed the tube through your nose. This is the most uncomfortable part of the procedure, but it's very brief. You will get used to the tube in a few minutes time. Okay, when it hits the back of your throat, take a delivery swallow. I'll tell you when. Now, swallow, swallow. That is, well done.
Okay, thank you, Helena. So as you can see, we are giving some instructions. These instructions are focused on make it easier, make it properly, and we can consider these instructions, these expressions, or maybe another kind of procedures when the patient is awake. This is an extra slide just for catching the vocabulary, the black and words, when we have the report of a diagnostic endoscopy. Please read this one, check the vocabulary. Tomorrow we can talk about it because it's a procedure that is described. But the most important part, in my opinion, are the new words and new expressions, okay? Read this, please. There's an example about the report we as doctors receive from the specialist who develops this procedure. It's a normal one, of course, without pathological situation. And now let's go to the X-rays. X-rays are a type of radiation used in the diagnosis and treatment of cancer and other diseases. I mean, X-rays go to take that kind of images and make treatment. In low doses, X-rays are used to diagnose diseases by making pictures of the inside of the body. In high doses, they are usually used to treat cancer. It's not a fact. They are not just for using just for cancer, but you know, the white part is radiopaque, the black one is radiolucent. We all know about it. Radiography and radiology. Of course, there's a difference, right? And that difference is could sound obvious, but it is not. Natalie, are you there? Can you hear me?
Yes, teacher.
Okay, thank you. Can you read this slide, please?
Sure. Radiography involves exposing a part of the body to a small dose of radiation to produce an image of the internal organs. Organs with high density, such as the ribs and spine, are radiopaque, meaning they do not absorb radiation and appear white or light gray on an image. Lung tissue is radiolucent, absorbs radiation, and appears dark on the image. Radiology is the use of radiation in the diagnosis and treatment of diseases such as cancer.
Thank you. So you can see, we all have this idea, we all know this concept, these differences, but it's better to focus them in English. In this slide, we have a chest X-rays, 2 pictures showing us some differences. The review areas, I mean the areas that we must recognize in colors and in black and white. This vocabulary, of course, is going to be so helpful in order to catch the vocabulary we need of this. So I'm going to send you this slide. You're going to receive this, but keep on practicing, okay? With the abdominal X-rays anatomy and review areas, of course, you have the same. Some more structures to evaluate, to consider, and to take in account, because if you have a correct X-rays technique developed, you can watch all of these anatomical structures in the picture. Before some types of X-rays, patients are given a liquid called contrast medium. We all know about it, such as barium or iodine, which is radiopaque and allows the organ or tissue to pills to be examined. The contrast medium may be swallowed, introduced through the anus as an enema, or given as an injection. So we know, and that's the way we can realize the structure when it's swallowed, for example, to check colon, okay, to check the big vowel, the large vowel, okay. Now let's go to some expressions. When we are developing the X-ray examination, we have the chance to give again some instructions and to make the patient fit to the radiographer, to the machine. So let's check. Pamela, can you hear me?
Yes.
Thank you. Can you read this slide, please?
Okay. Normally, a front antero-posterior view is obtained. The patient stands facing the photographic plate with the chest pressed to the plate, with hands on hips and elbows pushed out in front. The radiographer, the technician who takes the X-ray, asks the patient not to move, then to breathe in deeply and not to breathe out. This makes a blurred, unclear X-ray image less likely and improves the quality of the image, as it is easier to see abnormalities in air-filled, inflated lungs, that is, deflated lungs.
Okay, thank you. Usually the radiographer says, now take a deep breath and hold your breath. We all receive this. I know, well, I think, I'm not sure because, well, it happens. I think that all of us had the chance to receive an X-ray in this period of time, I think. Okay, it's important. And when we realize how the orders, how the instructions are given, we have the chance to make it, have the chance to realize that it works in this way. For a side or lateral view, the patient is asked to stand sideways to the photographic plate with arms raised. A chest X-ray may be repeated at intervals to track for any changes. These repeated examinations are called serial X-rays, or serial chest X-rays in this case. The radiographer usually says keep still for not moving and taking the breath in and not leaving it away. We have the chance in this slide to check the anatomical structures and then make the comparison with the X-rays. Just it's a general view, okay? There is a difference between X-rays, the basics, the posterior anterior and the anterior posterior. for making the comparison, how it looks like, just extra information. And we have some pictures in children, normal, the bacterial pneumonia, the viral pneumonia, and COVID-19 pneumonia. Extra information for practicing, for considering. But now we have these charts, lots of them. We have the different pathologies, different imaging studies, X-rays in PA position, the PA spot, I mean going closer to the lesion, to the structure that it's a normal. Another view that is getting raised, and the CT scan. The CT scan, another, of course, the two last ones are focusing on the lesion. We have the metastasis, a picture showing you how it could look like in the picture, in the X-rays, and you can make a comparison. The objective of these slides, of these charts, are giving you some more vocabulary to practice how to read this, how to analyze this information, and it's possible to check these differences. I'm not going to take an evaluation from this because it's too much, I think, but we can talk about it during the workshop if you want. But consider this, it's very, very nice chart, I think. Look at the congestive cardiac failure, how we evaluate this. It's nice. Check this, please. It's just extra information. It's for you. And we have this joke. I love jokes, I'm sorry. Don't be alarmed, it's just our technician photobombing your X-rays. I mean, photobombing is that act, that situation, when you cross your face into the picture, that actually is not for the one that is in that as an extra one. That face is the photobombing. Let's talk about ultrasound. The ultrasound. So let's read this. Stacy, can you hear me?
Yes, teacher.
Can you read this slide, please?
Okay. Ultrasound. A procedure that uses high energy sound waves to look at tissues and organs inside the body. The sound waves make echoes that form pictures of these tissues and organs on a computer screen, a sonogram. Ultrasound may be used to help diagnose diseases such as cancer.
Okay, thank you, Stacy. Thank you so much. So you can see ultrasound, very common study, I think, non-invasive, of course, no pain with this, it's cheap, but it has a disadvantage. It's according to the developer's experience. How the doctor that is developing this are the images we are going to catch. That's why it's important to get on practice on this. We can check how it works. On the ultrasound examination, you use high frequency sound waves, as Stacy was reading. And we can view organs and structures inside the body. The transducer, this device, is sending the waves into the body, and then we get the organ or the mass we want to study. This mass is with an echo, as Stacy said, and the imaging comes back, as you can see with the pointed lines. The transducer catches again this echo and shows you in a mirror view, I mean the opposite situation on the screen, and according to the screen, you can read the findings. This is very, well, could be very quickly if you have enough practice to do it. You have lots of range of referrals to consider how it is developed and define if it's well done or or not, or unsatisfactory. And of course, it has some specific situations that could make it harder. For example, in obese patients, it's not easy to do it. For preparing the patient to an ultrasound, we have some instructions, some steps to follow, I mean. And these steps can help us to understand, to check how it works. Melissa, are you
Yes,
there?
teachers.
Can you read this slide, please?
Sure. Preparing for an ultrasound. You will be asked to lie on an examination table. A special gel is applied to your skin. This ensures there are no air pockets between the transducer and your body. The transducer is moved over the area to be examined. You may feel some pressure and experience some discomfort, especially if the test requires you to have a full bladder. You may be asked to change your position for clearer pictures. When the radiologist is satisfied with the picture quality, the test is done and the gel is wiped off. A typical test may take between 20 minutes and 1 hour.
Thank you, Melissa. So you can see, maybe some discomfort. The gel, of course, is cold, yeah. But it's in general lines, easy to develop, easy to make. As a general view describing a medical imaging, we can use these expressions, these verbs that are in black and words. For example, we can say an ultrasound scan shows an intra-abdominal abscess. Another way to say it, an ultrasound scan of the abdomen demonstrated a small right renal tumor. Or another word, an ultrasound scan of the liver revealed reduction of metastases. So you have three important words: show, demonstrated, and revealed. And all of them are chosen according in the context you are talking about. So let's keep them in mind, okay? The computed tomography or the CT scan. Well, we all know that it's a procedure that uses a computer linked to an X-ray machine to make a series of detailed pictures of areas inside of the body. These pictures are taken from different angles and are used to create a 3D views of tissues and organs. You can see this is the machine, right? The CT scan and X-rays and the sources which rotate this around the body to produce cross-sectional images. This is a chart showing us how it works, just as an extra information, so don't worry about it. And we have some examples how the images look like, how we can reconstruct, how we can reorganize the pictures in order to check and to understand the situation inside the body. The scanner takes up to 16 simultaneous cross-sectional images, I mean slices, and transmits more data in less time than ever before. Each slice can be less than 1 millimeter thick, making it possible to find the very small abnormalities. So, very important to take into account. And well, making it clear, a CT scan uses, of course, lots of radiation to take these pictures. And when we make the change, we can say, to to compare with an X-rays. There are too many X-rays pictures. It's different, okay? The scanner will be used for diagnosing muscle and bone disorders, locating tumors, infectious and close monitoring the progress of malignant diseases and the response to therapy treatment, of course, providing accurate guidance for interventional procedures such as biopsies and drainage. I mean, removing fluid from a site to an injury or infection. Some extra images to consider, some 3D or full HD reconstructions from lungs with COVID-19, abdomen, the AP and cross-sectional, well, different views. We have different views. I'm gonna correct this typing mistake, I'm sorry, of a CT scan. We have the sagittal or side view, the coronal or frontal view, and the axial or cross-sectional view. And then you have how it looks like in the scan, the body position and the picture. For reading a CT scan, we have, of course, some key points, the most important. We have soft tissues, any fluid, blood will show up in various shades of gray, just the general information. Dense tissues like bone in white, we all know about it because at the X-rays. Air and fat show up as dark gray or black, you know about it. Just extra information. I have some examples to practice, to read at home, to check following the key points. So practice on them, very common ones. But some patterns that we have considered, because they are well described during these times, are this in blue color. The ground glass, for example, and the abbreviation GGO pattern is the most common finding in COVID-19 infections, for example. Then we have the crazy paving in blue again, and you have, well, it's pointed in the slide. So check this, read this information, catch as much vocabulary as you can, and we can talk about it tomorrow, okay? Don't forget the ground glass, crazy paving, the vascular dilatation. It's again, it's punctualized with a cross there. We have the traction bronchiectasis, okay? You can check this. We have the subpleural bands and architectural distortion, how the lungs structures are changing from this. And going to the abdomen, we have the normal abdominal CT, just as an extra to check the anatomical structures and define where they are placed. As you can see, like a mirror, always. Then we have an example, a jejunal perforation, secondary ablunt abdominal trauma, just an example. And we have a tumor that is signaled in the next slide. Just check this, extra information, don't worry about it. Then we have the magnetic resonance imaging, the MRI. When it's a procedure that doesn't use radio waves, it's coming from a powerful magnet and a computer to make a series of detailed pictures of areas inside of the body. Of course, it's the high definition study, in my opinion, because when you compare the MRI with the CT scan, you see obvious differences in the way to check the image and the resolution, I mean. Okay. So I have a little detail about the MRI. And let me see, it's gonna help now. Daniel, can you hear me?
Yes, teacher.
Can you read this slide, please?
Okay,
MRI is safer than X-rays because it does not use radiation. It provides more information than computed tomography about some head, neck, and spinal disorder because the images are more detailed and have more contrast, meaning the difference between dark and light areas are stronger. Unlike a CT, the images can be taken of any plane, any surface, or of the body seen from an angle. If it's not used for imaging, taking images of the brain and heart and on oncology.
Okay, thank you. The next paragraph is just showing this MRI of the scan of brain when you can evaluate this description just as an example, how this description is done. Read this, take the vocabulary, and well, you know, tomorrow we can talk about it. Some contraindications, of course, cases in which it should not be used. We all know about it. It includes patients with metallic foreign bodies, I mean in the orbits, and patients with pacemakers. Electronic devices surgically implanted to regulate the heartbeat. And MRI is also not approved during the first trimester of pregnancy. We usually say that it's possible to make it, but always. And it's better in the second and third trimester because it's not hurting the baby. So check this. I'm sorry. I'm getting lost with my device. Let me share it again. I'm running mad with my cell phone. As you know, I'm still learning how to use this. Okay. Okay, preparing for medical imaging. Again, we have some steps to follow. And we must consider this. We have to complete a safety questionnaire. In this safety questionnaire, we give all the information to the doctor, to the technician who's developing the procedure. And the patient is affirming, is giving, saying that no metal or clothing or person is in there in that moment. In order, this is a magnet. We cannot use metal objects that can interfere with the study because we can destroy the device, the MRI scan. So we have to consider this. You will be asked to remove metallic objects as well as credit cards, coins, keys, cell phone. Well, and you have to notice, you have to say that there are prostheses, okay? Usually the patient lies on the MRI scanner table and make yourself comfortable. If you're not comfortable, it's not possible to make. This study is too noisy, but as you were listening, is safer than the CT scan because of the radiation that is not necessarily enough. Usually the radiographer will position the part to be scanned carefully in the scanner, of course. And during the MRI scan, you cannot, you don't have to move, you have to stay still. Relax, stay still, and the imaging is going to be properly. So don't worry. It usually takes 45 minutes to study one section of the body. And according to this, we get the MRI sequences. Just as an extra information, we have two sequences in the charts. And with them, you can read the pictures. Just as an example, take the vocabulary from this. Abnormal MRI signals are in this list. So if you see something that it's not necessarily there, you have the two ways to do it. The body mass, you can see in both pictures, but the T1 and T2 are present. Read these slides, please. Let's check the electrocardiogram. A very general view of this. We all now have the chance to develop one during the med school, I think. We all had the chance to realize that it's a very common way to take and study and consider the patient situation, okay? Neil, can you hear me?
Yes.
Can you read the slide, please? The first and the second ones.
Okay. Electrocardiogram. It's a simple test that can be used to check your heart's rate and electrical activity. Sensors attached to the skin are used to detect the electrical signals procedure, but your heart each time it beats. It's a tracing or drawing procedure by an electrocardiograph, a device which records electrical activity in the heart.
Thank you. Carla, can you continue reading the third point, please?
Okay, teacher. An electrocardiogram records the electrical signals in the heart. It's a common and painless test used to quickly detect heart problems and monitor the heart's health. An electrocardiogram, also called ECG or EKG, is often done in healthcare provider's office, a clinical or a hospital room.
Thank you so much. So you could see very easy to catch the idea how it is done, how it works, and the objective of this study. Of course, we have uses for this device, for this ECG, yeah. And we have some vocabulary, specific vocabulary to remind. Diego, can you hear me? Diego. Okay. Don't worry. I know Maria is working. What? Andrea, can you hear me?
Yes, I can hear you.
Please read this slide.
Okay. Uses of an ECG. An ECG can be used for deciding if the heart is performing normally or suffering from abnormalities. For example, cardiac arrhythmia, extra or skip heartbeats, indicating damage to heart muscle, such as heart attacks or ischemia or heart muscle, detecting conduction abnormalities, heart blocks, and bundle branch blocks, screening for ischemic heart disease during an exercise tolerance test, often carried out on an exercise bike or treadmill, providing information on the physical condition of the heart, for example, in patients with left ventricular hypertrophy, detecting electrolyte disturbance, for example, low plasma potassium levels.
Thank you so much. Thank you, Andrea. So you can see uses are very clear, focused, and we will not have the chance to develop all of them or to look for all of them during the med school, in our case, right? This slide I'm showing you some patterns in English, of course. When you have the chance to evaluate how to 12-lead ECG analysis could be done, The abnormal ECG from ischemia, injury, and infarction is possible to be checked. Then we have some more patterns that are described in the yellow chart. And it's possible to notice how these waves are changing. So study this specific vocabulary. The procedure, of course, we all know how to develop this. We all know how to work on this. And in black and words, we have the specific vocabulary for the mind. As you can see in the picture, the patient is lying down on the bed. The patient must be relaxed. We calibrate the ECG machine. We go to the standard signals. And well, we attach the limb leads, left arm, left leg, and right leg. Then we record the 6 standard leads, 1, 2, 3, and the AVR, AVL, AVE complexes. And we apply the electrode to the 6 chest positions. In that way, we can read, we can feel all of these positions, all of these devices. It's on the patient, and it's possible to take the electronic activity. In this slide in colors, they are universal. Nowhere they are going to change. If you go to USA, to Pakistan, to Japan, no matter where you go, if you cannot read the language, there is no problem. The color is showing you the correct position of the 6 leads. Okay, the chest positions to evaluate. The normal ECG, as we all know, is this trace. We have the practice on this. And in black and words, we can see the specific vocabulary about it. So we can check that we have at the beginning, each largest squares is equivalent to 0.2 seconds. The RR intervals gives the heart rate. In this picture, well, the one with the circle is 75 per minute. In abnormalities, the QRS complex can be widened or too tall, and the ST segment can be elevated or depressed. The T wave can be the right way up or inverted, or the groove up, way up, the wrong way up, I'm sorry. Then in the next chart, you have the, not the structure, the picture of the normal ECG, just one complex showing you the wave, segment complex, and intervals. Read this general information just, again, maybe an ECG, if you want to practice, do it with this slide. We can talk about it tomorrow. And the 10 rules of a normal ECG is just extra information for catching the specific vocabulary while talking about it. So consider this as a class to read properly maybe one of these studies. And don't forget, greatness is a lot of small things done well. It was, I think, a presentation with lots of information, with lots of vocabulary, but it's possible to make it. So keep on working. Don't worry about it. And all the questions we can solve tomorrow. And it's going to be easier for us, I mean. So let me send you the pool to take attendance. And the slides I'm going to send you by WhatsApp in some minutes, please. I hope I can complete my connection to my laptop and correct it. So let me send you the pool. It's a mess working with a cell phone. I don't like it. I really need my laptop for making it better. Okay, I send you the poll. Please answer this. Fill the poll and I'm going to take the attendance through this time. Please, as soon as you fill the poll, send me a message to the chat, tell me done. This is gonna be the attendance I'm taking, okay? Okay, perfect. Let me see. Okay, I have 13 from, oh, okay, that's all. Okay. Okay. Can you all fill the poll? The ones who fill it can leave the session, or all of you can watch it, right? Okay. Okay, the ones who fill it. Yes. Okay, Neil, Andrea, and Natalie. That's all. Thank you. Thank you for staying. Okay. Natalie and Andrea, I'm going to close this. Thanks for your attendance. Natalie. Okay, Natalie, turn it and you can leave a minute and then come back. I'm gonna wait for you and send you again the pool. Okay, so don't worry about it. Oh, did you fill the pool, Natalie? Send me a message, please. Okay, perfect. If you fill the pool, that's all. I'm gonna send you in some minutes of the presentation. Don't worry about it. Thank you. Okay, Andrea, I'm closing this. Andrea. Okay, I'm closing this. Bye-bye. I know that Natalie is in trouble with the device, but don't worry about it.